Hello everyone, welcome to iDeRMS. This tutorial is for the patient management, our new module, and this module is applicable for all users. As you can see, once you log into iDeRMS from your dashboard, you can view the menu on your left. In the menu, you can see all the modules based on your user's account. For your patient module, there is a smaller sub-module which is patient management. So today we will brief about patient management module. When you click the patient management module, you will get this screen. Okay, there is note to all users. All users are encouraged to make a note regarding their patients for any particular reason regarding appointment or other issues. This is a new features that you can make note and you can upload images or whatever document pertaining to your patient's management. For example, you can upload print screen of the WhatsApp if you need to save it in the patient's record. If anything at all that you want to save pertaining to only administrative issues. Okay, for the clinical document like blood result or scan images or scan x-rays, you can actually put in the e folder as previously showed. For patient management is more or less for administrative only. Okay, so you can see the general patient overview here. You have assigned patients, past patients, all patients, active list, waiting list, recall patient list, request list. For students, you might not be able to see all the menus as shown on the screen right now. Okay, students are only allowed to use note section in this page. Means student can edit or can use notes for this section, but not the other menus. Okay, for other menus, it can be used by other users such as mentors, patient management team, head of department, or any other lecturers. Clinical mentors and patient care team may use this section to manage patient assignment to all students and others. All right. As you can see, there are assigned patient menu, past patient, and all patients. So for assigned patient is only pertaining to your patients that has been assigned to you. For past patient, those patients who have been assigned and unassigned to you. So you may see the names, but you may not be able to open the patient record. For all patients, you may view the name, but you cannot open the record if the patient is not assigned to you. All right, and down below, actually there are some menus that are available for other users, but not for students. All right, the most important thing here, you can actually go to your all patients, click view more, and once you click the view more, you can see this patient management list. From here, you actually can view all patients registered with us. All right. For example, I'm just going to click the patient administrative record. Okay. So you can see the RN number, name of the patient, the status, and the action. Okay, the action. So click the action button. And you can see the screen. This screen is available for everyone. You may view the basic info of the patient. And you also can view patient status. This is a new features that has been uh, in, included in the patient record. So each patient may be assigned one of the available status here. So the available status here is active, inactive, pending, deceased, active unassigned, and terminate. Patient who is active is means the patient is being treated by any users or treatment in progress. Patient who is inactive is not being treated by any users or has been uh, remain dormant for more than 7 years. Pending means patient who is new but awaiting for to be assigned to any users means the patient has got the referrals, internal referrals, but not been assigned to any users. Deceased patient who has passed away, you may not edit the record when the patient being awarded deceased status. For active unassigned, patient is still active within 7. Patient had an appointment within the 7 years, but not been assigned to any users. Means that the patient was seen by any users less than 7 years, but not been assigned to anyone yet. And then the last status is terminate. Terminate means patient has been terminated from our care because of few reasons. One of the reason is patient did not attend the appointment provided or given to them three consecutive uh, rows. Okay. And then after the patient status, there is administrative notes as I mentioned earlier. So to put the administrative note, you can type, all right, patient, for example, patient did not attend the appointment given for the past few months. And then you can do that and submit. Once you submit, it will go to the summary table below. So the summary table below will show all the records provided. I will, as you can see here, it shows at the bottom here, which is the latest one. If you want to change to the top one, you can just click the button, the arrow button at the date and time column, then it will go up. Okay, and you can click the action button, which is the upload document. So if you want to put a print screen or you want to give any evidence of your claim, you can just upload the document here and name the file that you want to upload and choose file. Okay, then you can choose a file like that. All right, and that is for the notes. And we have the list of providers for the patient. So for this particular patient, we can see all the active providers attending to the patient. And then we also have provider history, which means the provider that has been unassigned to the patient. And then we have internal referral or assigned patient, which is the patient that has been referred internally to the provider. And then we have appointment history for the patient. We have billing history for the patient. So you can see the whole billing provided by the for the patient. All right. So if the patient asks the billing history, you can actually refer to this menu. Okay. So that is pretty much for the patient management submodule that you may use for your patients. All right, this is important for the mentor as you can see this patient being attended by whom, and also you can actually assign the patient to any students. All right, I think that's it. Thank you.